Hello viewers, this is Dr. Jyoti, Obs and Gynae consultant in Stark Hospital, Kompally. Today I am going to discuss about pregnancy consultations, that is antenatal care. Okay, as pregnancy is very normal and a normal physiological process, most of the people think why a special care is needed. Though it is a normal physiological process, some people can have some issues in the pregnancy, and optimization of some conditions is very important in antenatal period to maintain both mother and baby's health. Okay, when it comes to antenatal consultations, it requires a minimum of 7 consultations for a multigravida, that is second, third and fourth pregnancies. In first pregnancy, female may have some issues, and to diagnose them, she may need 10 consultations. So in the first consultation, when a pregnant lady presents for the first time after getting her UPT positive, we check weight, height and other conditions, any family history and any personal history to be significant, so that any alteration in medicine or further checkups need to be noted. Along with that, at gestation of 7 to 8 weeks, a first early scan is done. This most of the people think, is it necessary? Okay, usually this is necessary because this confirms the date, because most of the people the date may be not remembered properly, or due to irregular cycles the date may not correct. So this acts as a dating scan, and also it gives the fetal viability, and it also rules out any chances of ectopic pregnancy, that is presence of pregnancy in areas other than the uterus, that is like fallopian tube and all. By that we can avoid unnecessary emergencies. Then next comes the visit at 11 to 14 weeks of gestation. There comes again a scan called as NT scan, which is necessary to rule out the chromosomal anomalies in the baby, and these chromosomal anomalies are very lethal to the baby. The babies with those anomalies cannot survive. That's why it is mandatory nowadays, universally, to screen every pregnant female. And next comes the TIFA scan, which is also called as anomaly scan, which is usually done between 18 to 24 weeks of gestation, but the proper time is between 20 and 22 weeks of gestation. This gives the overall view of the baby, and the scan takes a little bit more time so that any anomaly, if possible, is there, can be detected. Okay. Then comes the 24 weeks. Usually at 24 to 25 weeks of gestation, the fetal heart is developed properly and can be seen through scan properly, so that any cardiac anomalies, if are there, can be detected at this stage of gestation. So usually fetal 2D echo is advised at that point of time. Actually, in previous days, this is not mandatory, as TIFA is normal and the mother is not having any comorbidities. Usually, we used to not do fetal 2D echo. But in recent time, it has become mandatory because most of the babies who are getting any issues after birth, like any cardiac anomalies at 3 months or 6 months of gestation, the pediatric cardiologists are advising better to know them beforehand, so that the consultations will be properly scheduled. Then comes the 7th month, that is at 28 weeks of gestation. So usually from this gestation period, all the maximum possible anomalies are ruled out, and maximum possible chromosomal issues can be ruled out. So from this gestation, main focus is on the growth of the baby. So from 28th week, the growth of the baby will be increased. So the growth is appropriate according to the gestation, and also the amniotic fluid, which is, we say, water inside the womb which protects the baby, is appropriate to the gestation, and any placental changes are there, we have to know. Then accordingly, if needed, in between also scan is done. Otherwise, at the end of 9th month, that is before the delivery, once to confirm everything is alright, we go for a scanning also called as growth scan. Okay, so these are all about the scannings which are performed in a pregnant female who are at low risk. So pregnancy is never considered as a zero risk, it is just considered as a low risk or high risk based on the circumstances of the female.